So now I'd like to give you some specifics for your upcoming blepharoplasty, whether that be your upper lids and or your lower lids. This will kind of help give you some information from that standpoint. So you'll have the surgery, you'll spend some time in the recovery room, then you'll go home. You will not really have any specific dressings, but the nurses will send you home with some little 2x2 gauze, most likely, that you can dip in ice water. That night, even the first 24 hours or so, or as much as you want, it's really up to you. You can dip those 2x2 gauze in some ice water and then put them on your eyes, and it just feels good. It just kind of takes some of the swelling away, but also just feels better. So that's something you can do to help with that. We'll also send you home with a tube of some ointment that goes in your eyes at nighttime. It's almost like Vaseline type substance. So it's going to make your eyes blurry. That's normal. But put those in at night. It'll keep your eyes moist and not let them dry out. I would also recommend you pick up beforehand an over-the-counter drop called Refresh Gel. It's kind of oily, like olive oil, and you can put that in your eyes as much as you want, and that just feels really good and will help things be more comfortable afterwards. That first night, you also have medications. So you have some pain medicine and some nausea medicine, so you can take that as you need to. You shouldn't really need any antibiotics for this type of procedure, unless it's combined with something else that may require it. Then you'll just make it through the night well with that. Sleep elevated. Don't be bending over. Don't be getting your blood pressure up. Don't be scratching or anything like that, obviously, on your eyes. You'll have some sutures in with some little, like the suture themselves, it's blue, but it'll actually come out the ends and be taped down. So just kind of be aware of that. Don't think it's a hair and try to pull it out. And those little tapes, just leave them in place. Then the next day, you'll come in and see me. We'll check in on everything, just make sure you're doing well. Then at that point, you'll see me again at postoperative day 5, and we'll take all your sutures out at that point. We'll also put some little strips of tape on that potentially to kind of help with those lateral extensions of the incision. Also, another thing that people ask about a lot, especially if you have your lower lid, you'll see some dimpling and divoting with almost like a little crease of skin on the sides. That's where that lower lid is anchored to the bone with suture that's temporary. Because of the swelling also, it exaggerates that a lot, and you get this kind of dimpling there. It'll look kind of odd, that's normal. That can even last to degrees for a few weeks. I'll have you leave it alone at first, but then I might have you massage it at a certain point. So don't be alarmed by that. That's very, very normal for part of that healing process. Overall, there's not really any restrictions for this type of surgery. Just don't overdo anything. Don't get your blood pressure up at the beginning because we don't want you to bleed. Don't be rubbing on anything. Try not to sleep right on your eyes at that point. But overall, this should be a very well-tolerated surgery and help through that. So if you have any questions, give us a call. Otherwise, I look forward to seeing you the day of your surgery.